Hello, good evening. I want to be sure we can hear me. Can you hear me? Okay, okay. Good evening. Good evening. Yeah, can we hear me now? Okay, good evening. Seems you are back online. Sorry for the breaks and Awelewa, can you hear me now? Um Hello, 58 seconds again. Good evening, everyone. Sorry for the technical challenges. Okay, welcome. If you can hear me, just drop a comment in the chat box. Let me know if you are able to hear me. So if you are able to hear me, let me know in the chat box. So just comment you can hear me so that I'll know we are there. Good evening, Alia. So can you still hear me? I want to know if you can hear me so I can continue. Good evening. So as I was saying the other time before we got disconnected, we'll be looking at from stigma to statistics, how to strengthen mental health advocacy through health information. Okay, seems we are back online. Jesus is Lord. Okay, so can I continue? Let me know when I can continue. I think our network is better now. Okay, so I was trying to explain the concept of mental health, and I said that mental health is the state of well-being, is the state of well-being on of an individual in which they realize their potential, they are able to cope with normal stress of life and work productively and contribute to their community. So that is a mentally stable person, somebody who can understand their potential, they are able to cope with normal stress of life, and they are able to work productively and contribute to their community. That is who the WHO, the World Health Organization, said to be a mentally healthy person. So now, when we talk about mental illness or mental disorder, it's a condition. So it's a condition that affects the thinking, mood, behavior, and that causes significant distress or impairment in daily life. So we can say somebody who thinks too much, who has an unstable mood or unpredictable behavioral pattern can be said to have a mental disorder. So it doesn't have to be until somebody is on the street tearing clothes and all that before we say this person has a mental illness. A deviation from normal mood behavior or from normal behavioral pattern of an individual can be said to be a mental illness. Example of this is depression. So somebody can be depressed, and another example is anxiety, being overly anxious about states of things of what might happen or what might not happen. It's a sign of mental disorder or mental illness. Also, we have schizophrenia or sleeplessness. All these are examples of mental illnesses. Now, another key term that we'll be looking at is stigma. So, when we said stigma, from our seminar topic, we said from stigma to statistics. So, what do we mean by stigma? Stigma is the negative attitude or discrimination or stereotype directed at individuals with mental health challenges. Now, stigma is a stereotype, it's an ideology that somebody who is not mentally healthy has to be a very bad person or a very worse person, so to say. So it's a stereotype, it's a stigma that this person is a mentally ill person. This person is somebody who is not socially fit to be related to. So those are that is what stigma is about. That is what stigma means. Stereotyping an individual for the state of mental health. That is stigma. And most times, stigma often prevents people from expressing their mental status. It often prevents them from expressing their mental status. Now, Earth information management is the systemic collection, analyzing, organization, storage, analysis, and presentation of Earth data to support decision making in healthcare delivery and policy formulation through the use of paper records or electronic medical system. So basically, Earth information management is how Earth data are being collected, analyzed, and presented for decision making. And Earth information systems, they are systems or platforms that enables us to collate, to do what Earth information management does basically. So they are the systems, they are softwares, they are platforms or digital softwares or programs that allows us to manage, to collect, manage, and interpret and analyze um, Earth data. That is Earth information system. So we are also going to be looking at advocacy. What do we mean by advocacy? These are actions that are being taken to raise awareness as regarding mental health illnesses. So that is what advocacy is about. Then we are going to be talking about data collection. Is the process of gathering accurate, reliable, and complete health information from patients, facilities, and communities for analysis and reporting. So that is what data collection is about. So then we'll be looking at prevalence. Prevalence is the proportion of individuals in a population who have a specific condition at a given point in time. So, for example, as we are looking at mental um, illness or mental health, the prevalence rate of mental health can be said to be the numbers of people who are suffering or who has a mental illness or mental decisions across a population at a given time. So let me give us an illustration to better drive home the status of mental health in Nigeria or mental illness. Imagine for a moment that there is a young man in Lagos, Nigeria, suffering silently from depression, but he feels hopeless and isolated and ashamed because culturally in his community, mental illness is seen as a taboo or as a sign of weakness. So such a person is unable to come forward to healthcare facilities or to healthcare professionals to explain the status of his mental health. Now there are policymakers in Abuja who are unable to make adequate policy formulation for mental health because they do not have quality or reliable data or insufficient data to know the actual number of the prevalence rate of mental illness in Lagos or in Nigeria in general. So, so there is need for us as an HRM professional to raise awareness to prevent stigmatization of mentally ill individual by maintaining the confidentiality of patient health information and increasing the awareness or the advocacy for the need for mental screening and mental health education. Now, in generally, the World Health Organization, they estimated that 1 in 8 individual globally lives with a mental disorder. 1 out of 8 person across the globe has a mental disorder. So that is this statistics is from WHO, and in Nigeria context, mental health issues affect over 40 million people according to WHO in Nigeria. Mental health issues affect over 40 million people, and yet less than 10% of these 40 million people, that is only about 4 million people out of 40 million that has mental disorder, are able to get treated for mental disorder. So these are not just figures or numbers, they represent real lives. These are people that we talk about. They are real families, and this can contribute to real losses due to certain negativities that could arise due to aggravated mental illness or untreated mental illness. But here is the paradox. Why the burden of mental illness is heavy, the availability of quality data to drive decisions is still alarmingly high. That is where you and I, as an HIM professional, comes in to ensure that there is proper capturing of patient data or of individuals who might be suffering from mental illness. Now, what are the power of health information in mental health advocacy? One, we are going to be looking at from stigma to data driven dialogue. Data is life, data is the backbone of healthcare. So, if we are unable to accurately, or we are unable to gather data that are accurate, timely, and reliable about mental illness in Nigeria, we will not be able to have effective policy to work towards the prevention and management of mental illness. So now, there should be traditionally, mental illness was shrouded in silence and cultural myth. In some parts of Nigeria, they believe mental illness a cultural attack. It's a sign of weakness, and it's oftentimes incurable. These are myths. These are sociological myths that has guided or that has shown in Nigerian context. But through systemic collection, analysis, and dissemination of data, we are able to move from myth to measurable fact. For example, reporting prevalence rates of depression among adolescents in Osun State can help ministries of education integrate school-based intervention. As I was saying, there's power in data. When we're able to collect that, okay, in Osun State, this is the rate. The other time I was mentioning the prevalence rate. That's how many person per community are suffering from a certain condition. In this case, mental illness. Once we are able to have the prevalence rate, let's say among a given population in Osun State or in a certain place at a certain time, there will be the government will be able to make decisions as to how they can better um, have an health policy to prevent, manage, and cure the mental disorder in that particular area. So now, another um, another area where health information can come in mental health advocacy is evidence-based advocacy. Health information managers can ensure that data on mental health is not lost either in paper records or on digital records, or they are fragmented. We should ensure that the data in our care are not fragmented. They are they are consolidated into statistics that can speak into policymakers, donors, NGOs, and community. So without this data, advocacy just remains stories. It becomes an hearsay that we can only just be saying when there are no figures, when there are no facts to support this drive, this advocacy, it becomes just a story. We cannot just say in Ocean State there are 5 million patients or 5 million individuals with mental illness without having an adequate data to back up that statement. So if I just come up and just say there are 5 million individuals suffering from mental illness in Nigeria, in Osun State, without adequate data to back it up, it becomes an essay. It becomes just my opinion. It becomes just what I said. So we'll not be able to have an evidence-based advocacy without evidence data. So how do we break the mental health stigma? How do we break mental health stigma? For example, um, a hospital can dedicate a mental health help desk, and they can use HRM professionals to collect anonymous reports of stigmas in patient interaction. So these informations now, when they gather these reports, can be used for health workers retraining in order to reduce discriminatory practices in mental health care. Now, also, we can have a building system of data collection. Like I said, for us to be able to have an evidence-based advocacy, there must be reliable data. So we can establish mental health registers in healthcare facilities. We can integrate mental health data into the DHIS or the HMIS of the Federal